Okay, well, it's a real pleasure to participate in this video conference. We all are being affected by COVID. I think it's important that we share our experiences and learn from each other in addition to the literature because we are all in this together and all have things to learn that are new on a daily basis. As someone said, we are flying the plane while we are building it. We just reviewed conditions that we feel represent children who are increased risk for more severe disease should they be infected with the COVID-19. And if we can just go back to the other slide for 1 second. We felt that would be important. Now, you have to realize our school year in Canada goes September to the end of June. The government is now planning on opening schools in mid-May till the end of June. So we addressed this towards that window. We felt that healthy siblings go to daycare or school. It's very important that everyone practice good hygiene. So when they're out of the house, social distancing, they may need to wear masks. They certainly need to practice very good hand washing, which is 20 seconds with warm water and soap, which is quite effective. We feel it's very important when someone comes in from the outside that, again, they practice proper hygiene, particularly washing hands as soon as they come into the house, because we know that very often siblings can bring home viruses, just regular viruses from outside.
May I ask a question? How do you feel about children wearing masks, let's say during some, not in class, but outside? It can be raining, and they can be running, the mask can get wet. Do you think it will still be as effective as a protection, or do you think it should only be in class when they're very close to each other?
I think a wet or soiled mask is useless and offers no protection. I think, it is one thing to be out in fresh air as long as children are not very close to each other, that there is less risk of spread amongst children. We do not know how much, because we have been doing this isolation, we really do not know what the potential is for spread amongst children, especially if you consider that many children will have asymptomatic infection. While they are positive, their viral load might not be as high. So they might not be as contagious, but this has not been proven as yet. In the classroom, which is more an enclosed space, again, social distancing. What I've seen, especially, let's say in Taiwan, and now that they are reintroducing schools in parts of Europe, that the children are wearing masks in class and that the teachers also wearing a mask. Class size has been decreased by half so that they can spread out the desk. The children also eat their lunch at the desk. So they are trying to limit spread within the classroom as well.
So just to summarize, we mentioned before that the children may be less vulnerable apart from the children who have the diseases that we discussed before. You just mentioned experience from other countries where they try to increase the social distancing by reducing the number of students in the class. Apart from that, you mentioned that in a class, wearing a mask may help, or eating a lunch at your desk may also help to decrease the likelihood of infection spread. And we also discussed some, yesterday we discussed some of the recommendation about medication check. It seems to be self-explanatory, but many children or many parents forget to check this. I guess recommendation would be not to have an expired medication or empty medication. So how soon do you think updated recommendation will be available?
I think probably by early summer, as we get the experience from places that have returned to school. I will note that Taiwan never stopped their schools, but did practice social distancing. They did wear masks. Their culture was very much attuned to wearing masks for viral illnesses. And they seem to have kept viral spread quite low.
So you think that in early June, we can reach out to you again, and if you have further recommendation, we can benefit again from your expertise?
I think, yes. I think probably closer towards the end of June, just because it'll give us about 2 months of experience. Actually, in Quebec, they are not going to open up the high schools or universities. It's just the primary schools, so it's the first 6 years of school. They felt it was too difficult for adolescents to practice social distancing.
Ah, interesting. I would have thought otherwise.
Yeah.
But what about daycare? We talked about school, and what about daycare?
So daycare, people are, you have to realize that we have government subsidized daycare. And so the majority of young children under the age of 4 are in daycare. And other than the at-risk groups, we are recommending other children can go back to daycare. We are more concerned about the daycare workers than the children, and they will have to practice excellent hygiene.
So, and since we're at infection control, and you just made a statement about children and adults, such as in a daycare, what about children visiting their grandparents after quarantine?
I don't think anyone feels at all comfortable that the children should be visiting their grandparents if the grandparents are over 60 years of age or who have at-risk factors.
So better not. So better abstain from that.
Yes.
So it's important to emphasize, I'm agreeing, if grandparents have conditions, they're above 60 years old, do not visit.
I would just like to mention the Swedish experience, and Sweden has had a much more open policy than the majority of countries. Even there, they have shielded and protected those who are 70 years and above. So even in one of the most open environments, they are protecting their older people.